Right now, doctors and pharmacists in Ohio are warning they're in the middle of a real Tamiflu shortage, as we're seeing people get sent to the hospital for the flu at the highest level in 10 years. You probably know Tamiflu, right? You pop it in your mouth, you get it for the flu or for RSV or something like that, some sort of respiratory infection. But because the flu came a lot earlier this year, the treatment's become hard to find. And this kind of shortage is not just happening in Ohio, it's happening across the country with some other drugs, too. Jesse Kirsch has more.
Hallie, at least one health system near Cincinnati telling us that they are seeing localized shortages of Tamiflu, and this is coming as we continue to see the virus surging across much of the country. Public health officials in Cincinnati say they are seeing what they call a, quote, strong early flu season. And we asked them about Tamiflu supply, and they told us that, in part in a statement, quote, while the supply of Tamiflu has been lower than usual, most people with the prescription have been able to find a local pharmacy with it in stock. Our Chicago station, WMAQ, says that CVS told them, in part, quote, while we're not experiencing a widespread shortage of Tamiflu at this time, we are seeing increased demand at our stores nationwide and sporadic shipping from select manufacturers. Adding, in part, there will be increased instances when individual pharmacies could be temporarily out of stock. WMAQ reports that Walgreens also said that there are, quote, temporary and isolated shortages of Tamiflu at its pharmacies. That healthcare system near Cincinnati says that it is prioritizing giving Tamiflu to patients who, quote, are at higher risk of influenza complications, who have symptoms less than 48 hours. That medical team recommending you go to the emergency room if you experience symptoms including shortness of breath, chest pain, confusion, or if you're feeling lethargic. There is another medication that St. Elizabeth Healthcare, the team in the Cincinnati area that we spoke with, referred to, but that medication can be quite pricey. They say around $160 to $180 for the single dose needed. It is also something that team says should not be prescribed to pregnant women. So obviously the options can be somewhat limited in this space. Public health officials recommending that some of the best things you can do to protect yourself: get vaccinated, practice good hygiene, and if you are not feeling well, stay home. Hallie?
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.